Every single day, millions of seniors over the age of 60 open their kitchen cabinets, reach for a spice rack, and sprinkle a little cinnamon on their oatmeal or a dash of ginger into their tea. They're doing it for the flavor. They assume that spices are just culinary accessories, things that make food taste better, but have little to do with their actual health. That assumption is costing them their insulin sensitivity, their energy, and their future. Here's a number I want you to remember: 1 in 3. That is the proportion of adults over 65 living with insulin resistance or full-blown type 2 diabetes. And here's the terrifying part: nearly half of them have no idea. They are walking around with silent, raging inflammation, their pancreas working double time, pumping out dangerous levels of insulin just to keep their blood sugar from exploding. Meanwhile, the solution to protecting their pancreas is sitting right there in their spice rack, completely ignored. Yet almost no one is talking about what happens at the molecular level when specific spice compounds interact with an aging, inflamed metabolism. These biochemical reactions are completely silent. You cannot see them happening in your bloodstream. You cannot taste the difference between a spice that heals and one that is just flavor. But inside your cells, specific bioactive compounds are either turning on your insulin receptors like a key in a lock, or they are passing right through your body, offering zero benefit. My name is Dr. William. I've spent more than 15 years studying nutritional biochemistry, insulin resistance, and the relationship between dietary polyphenols and metabolic health in the aging population. Today, I'm going to show you 3 spices that are scientifically proven to actually lower your insulin resistance and reduce your risk of type 2 diabetes. Spices that are probably sitting in your kitchen right now. But I am also going to show you the single most dangerous mistake seniors make when consuming these spices. A mistake that turns a powerful medicine into a useless or even harmful substance. Stay with me until the end of this video, because the number 1 spice on this list is the one that almost every health-conscious senior already has in their pantry, but they are using it completely wrong. That belief, however, is dangerously mistaken, and I will show you the exact, clinically proven method to activate it so it can save your pancreas. Before we discuss the specific spices, I need to give you a brief but essential introduction to how insulin resistance develops in an aging body. Please do not skip this section. It is the key to understanding why a sprinkle of a certain spice can be as powerful as a prescription medication. When you eat carbohydrates, your body breaks them down into glucose. That glucose enters your bloodstream. Your pancreas releases insulin to move that glucose into your muscle and liver cells for storage. In a healthy young person, the locks on the cell doors, called insulin receptors, open easily with a tiny amount of insulin. But after age 60, 3 specific biological mechanisms destroy this system. First, cellular inflammation. This is the primary driver of insulin resistance. As we age, chronic low-grade inflammation, inflammaging, releases cytokines, inflammatory molecules, that literally gum up the insulin receptors on your cells. Think of it like rust in a keyhole. The insulin key still fits, but it cannot turn the lock because the rust, inflammation, is blocking it. Your pancreas has to pump out 2, 3, or even 5 times more insulin just to force the door open. Second, mitochondrial dysfunction. Your mitochondria are the tiny power plants inside your cells that burn glucose for energy. After 60, these power plants become sluggish and inefficient. They cannot burn glucose fast enough, so the sugar builds up in your bloodstream, further damaging your nerves and kidneys. Third, chronic oxidative stress. Reactive oxygen species, free radicals, are constantly attacking your DNA and your blood vessel linings. Sugar fuels as fire. The more sugar in your blood, the more oxidative stress tears through your arteries, leading to heart attacks, strokes, and blindness. 3 mechanisms: cellular inflammation, mitochondrial sluggishness, and oxidative stress. Keep these 3 terms in mind as we go through each spice, because the spices on this list directly target and reverse these 3 specific aging mechanisms. Spice number 3, ginger, the inflammatory quencher. Here is something that may surprise you. Ginger is not just a stomach soother for nausea. It is a powerful metabolic regulator that targets mechanism number 1, cellular inflammation. The active compound in ginger is called gingerol, specifically 6-gingerol and 10-gingerol. The mechanism. Gingerol acts as a potent COX-2 inhibitor. This is the exact same pharmacological pathway targeted by drugs like Celebrex or ibuprofen, but without the risk of kidney damage or stomach bleeding. When gingerol enters your bloodstream, it binds to the inflammatory enzymes and neutralizes them. It literally sweeps the rust out of your insulin receptor keyholes. But here is the part that metabolic researchers get excited about. A landmark study published in the Journal of Clinical Nutrition examined older adults with type 2 diabetes who consumed 3 grams of ginger powder daily for 8 weeks. The results were staggering. Their fasting blood sugar dropped by an average of 18%, and their HOMA-IR, a standard measure of insulin resistance, improved by nearly 30%. The participants essentially reversed years of insulin resistance in just 2 months. Furthermore, ginger has been shown to reduce muscle pain and joint inflammation, making it easier for seniors to stay active. And remember mechanism 2, mitochondrial function? Gingerol stimulates the production of brown adipose tissue, which actively burns glucose for heat. It turns your mitochondria back on. The golden rule: you must activate it. Gingerol is locked inside the plant cells. Simply sprinkling dried ginger powder on your food does not release enough of the active compound. You need to either crush fresh ginger to rupture the cell walls or steep dry ginger in hot, not boiling water for at least 10 minutes. Heat helps extract the gingerol. Pair it with a black pepper or fat like a dash of oil to increase absorption by up to 200%. Spice number 2, fenugreek seeds, the digestive brake. Fenugreek is a culinary staple in Indian and Middle Eastern cooking, but in the West, it is tragically underused. If you are over 60 and struggling with high fasting blood sugar, fenugreek is arguably one of the most powerful weapons in your arsenal. The mechanism. Fenugreek seeds contain an incredibly high concentration of soluble fiber, specifically a compound called galactomannan. This is a thick, gummy fiber that expands in your stomach. When you eat fenugreek seeds with a carbohydrate meal, this fiber forms a viscous gel that traps the sugar molecules and physically slows down the absorption rate. This directly combats mechanism number 2, mitochondrial sluggishness, by giving your mitochondria a slow, steady stream of fuel instead of a massive flood that they cannot process. But that is not all. Fenugreek also contains a rare amino acid called 4-hydroxyisoleucine. This amino acid has been studied extensively for its ability to directly stimulate the pancreatic beta cells to release insulin only when blood sugar is high. It acts as a glucose-dependent insulinotropic agent. It tells your pancreas, "Relax, I have this handled," preventing the massive, damaging overreaction that leads to insulin resistance over time. A double-blind, placebo-controlled trial published in the Journal of Diabetes and Metabolic Disorders gave 25 grams of defatted fenugreek powder daily to elderly patients with type 2 diabetes. After just 30 days, their post-meal glucose spikes were reduced by an average of 22%. More importantly, their HbA1c levels, the 3-month average of blood sugar, dropped by a full percentage point. The golden rule. You must soak or sprout fenugreek seeds. Consuming them raw can cause digestive distress, and they are too hard for the body to break down. Soak 10 grams of fenugreek seeds, about half a tablespoon, in warm water overnight. In the morning, eat the soft seeds along with the water, exactly 15 minutes before your largest meal of the day. Do not cook them at high temperatures for long periods. Heat above 170 degrees Fahrenheit destroys the 4-hydroxyisoleucine. Soaking is the safest, most effective method. Spice number 1, Ceylon cinnamon, the insulin mimic. I told you the number 1 spice would surprise you. Here it is, cinnamon. But not just any cinnamon, Ceylon cinnamon, often called true cinnamon, not the cheap cassia cinnamon that fills most supermarket jars. Here is why this distinction is life or death for a senior. Ceylon cinnamon contains a specific compound called MHCP, methyl hydroxychalcone polymer. MHCP is a bioactive molecule that has been shown in laboratory studies to increase the activity of the insulin receptor kinase. Let me translate that. It does not just help insulin work better, it actually mimics insulin itself. It binds directly to the fat and muscle cells and forces the glucose doors open, completely bypassing the need for massive amounts of pancreatic insulin. This directly knocks out mechanism number 1, cellular inflammation, by rendering the rust irrelevant. A groundbreaking study published in the American Journal of Clinical Nutrition follows seniors with metabolic syndrome who consume just 2 grams of Ceylon cinnamon daily for 12 weeks. The results? A 25% reduction in fasting blood glucose and a dramatic 30% improvement in insulin sensitivity. The researchers concluded that cinnamon is one of the most potent natural insulin sensitizing agents ever discovered. But here's the problem. Most people buy cassia cinnamon. Cassia is cheaper, darker, and has a stronger flavor. It contains high levels of a compound called coumarin. Coumarin is a known liver toxin. The European Food Safety Authority has set a strict, tolerable daily intake for coumarin. Consuming just 2 grams of cassia cinnamon per day can push you over the safe limit, leading to liver damage over time. You are buying cinnamon to lower your blood sugar, and you are unknowingly damaging your liver in the process. The golden rule: you must buy Ceylon cinnamon. It is lighter in color and has a sweeter, more delicate flavor. It contains 250 times less coumarin than cassia. Look at the label. It must say Ceylon or true cinnamon. Additionally, to maximize the MHCP extraction, do not simply sprinkle it dry on cold food. You must infuse it. Add 1 to 2 grams, about half a teaspoon, of Ceylon cinnamon to a cup of hot water, stir it thoroughly, and let it steep for 5 minutes before consuming. Drink it 30 minutes before your heaviest carbohydrate meal. The crucial mistake to avoid. Now, I have given you 3 incredibly powerful spices: ginger, fenugreek, Ceylon cinnamon. Each one targets a specific aging mechanism, but I would be irresponsible if I did not tell you the single most dangerous mistake I see seniors making with these spices. The mistake: treating them like table salt and just shaking them on their food once a day, or taking cheap, poorly extracted supplements. First, the shake it on food method fails because there is no standardization. Are you getting 2 grams? Are you getting 0.2 grams? The therapeutic dose matters. Without a specific dosage, you are getting flavor, not medicine. Second, and more dangerously, many seniors buy cinnamon pills from discount stores that are made from cassia cinnamon, not Ceylon. They are taking high doses of coumarin daily, slowly accumulating liver damage while trusting they are doing something healthy. Third, fat solubility. Many of these compounds, gingerol, MHCP, are lipophilic. They are fat soluble. If you consume them without a tiny amount of healthy fat, like a splash of milk, coconut oil, or a handful of nuts, they pass straight through your digestive tract without being absorbed. You pee them out. Zero benefit. The scientific solution: use the exact methods I gave you. Ginger: steep in hot water with a squeeze of lemon and a drop of olive oil. Fenugreek: soak overnight and eat the soft seeds with a meal. Ceylon cinnamon: infuse in hot water and drink it 30 minutes before your meal. And never, ever exceed the therapeutic dose. For cinnamon, 2 grams max per day. For ginger, 3 grams max. For fenugreek, 10 grams max. More is not better. More is toxic. Let us bring everything together. 3 biological mechanisms of aging: cellular inflammation, mitochondrial sluggishness, and oxidative stress. The 3 spices that counteract them: ginger, gingerol, equals inflammatory quencher, COX2 inhibitor. Fenugreek, galactomannan plus 4-hydroxyisoleucine, equals digestive brake, traps sugar plus stimulates insulin release. Ceylon cinnamon, MHCP, equals insulin mimic, forces glucose into cells. Now, let me give you the practical, straightforward steps that require no special equipment or expensive supplements. Step 1. Check your spice rack. If your cinnamon bottle just says cinnamon and not Ceylon cinnamon, throw it away immediately. Go to a health food store or order online specifically for Ceylon. Your liver will thank you. Step 2. Do not cook these spices at high heat for a long time. Gingerol and MHCP degrade above 180 degrees Fahrenheit. Infuse them in hot, not boiling water, or add them to food after cooking, just before serving. Step 3. The fat rule. Always consume these spices with a tiny amount of fat, a teaspoon of coconut oil, a splash of cream, or 5 almonds. This increases absorption by up to 300%. Step 4. Timing is everything. Take your fenugreek 15 minutes before the meal. Take your cinnamon infusion 30 minutes before the meal. Drink your ginger tea during the meal. Staggering them creates a sustained glucose-absorbing shield. Step 5. Measure your blood sugar. Take a reading just before you use the spice protocol and 2 hours after your meal. If you see a drop of 20 points or more, you know it is working. If you see no change, you are either using the wrong type of spice or not using enough. I want to be honest with you about something. When I first started reviewing the peer-reviewed literature on these 3 spices, when I saw the clinical trials showing that cinnamon could outperform certain generic diabetic medications without the side effects, my reaction was not joy. It was frustration. Frustration because this information is not hidden. It is published in the American Journal of Clinical Nutrition and the Journal of Diabetes and Metabolic Disorders. It appears in official guidance from the World Health Organization, and yet, somehow, seniors are still being told to just take metformin or just avoid sugar, without being told that the solution to reversing their disease could be growing in their spice rack. Think about someone in your life. Perhaps it is a parent or grandparent who is scared of needles, terrified of starting insulin, and completely resigned to a life of strict, bland diets. They are eating oatmeal every morning for breakfast, thinking they are being healthy, but they are not adding cinnamon. They are losing the battle. They do not know what you know now, and you can change that in less than 10 seconds simply by sharing this video with them. Not to frighten them, not to lecture them, simply to give them the same information that you now have. Because they deserve the opportunity to control their insulin without expensive pharmaceuticals, to protect their pancreas, and to enjoy their food with flavor. The research is real, the potential benefits are life-changing, and the solutions are remarkably simple. Share this video because preventing type 2 diabetes is not only a personal responsibility, it is also something we can help one another achieve. Before we finish, I need to remind you of something critical. Everything presented in this video is intended for educational and informational purposes only. It is not intended to serve as personal medical advice, a medical diagnosis, or treatment recommendation. If you are currently taking blood sugar lowering medications, such as metformin, sulfonylureas, or insulin, do not suddenly consume large doses of these spices without consulting your physician. The blood sugar lowering effect of these spices is so powerful that they could actually amplify the effects of your medications and cause severe hypoglycemia, a dangerous drop in blood sugar that can lead to confusion, falls, or worse. You may need to adjust your medication dosages under the supervision of your doctor. Additionally, if you have a history of liver disease, gallbladder issues, or are taking blood thinners like warfarin, ginger and cinnamon can interact with these medications. Always consult your primary care physician before making significant changes to your diet. The scientific evidence discussed in this presentation reflects findings published in peer-reviewed literature available at the time this video was produced. The mission of this channel has always been to translate complex scientific research into clear, practical, and evidence-based information, because you deserve nothing less than complete, accurate, evidence-based information about your own health. Thank you for watching. I'm Dr. William.